My name is William Stetson from Stetson Powell Orthopedic and Sports Medicine Center in Burbank, California. This is a video describing the technique of the arthroscopic excision of a symptomatic os acromiale. I'd like to thank my co-authors, Alex McIntyre and Genevieve Mazza. These are my conflicts of interest. None of these have anything to do with my current presentation. After failing a long course of conservative management, the patient was taken back for diagnostic arthroscopy of the glenohumeral joint and then diagnostic burstoscopy. Here we're in the subacromial space, which looks perfectly normal. We're looking from posterior to anterior with the shaver out the front. We can see the lateral bursal curtain. Again, the bursal side of the rotator cuff is completely healed, no evidence of any bursitis and no impingement lesions. We then started to proceed with the arthroscopic excision of the meso-acromiale. We're looking from posterior to anterior. The radiofrequency device is coming through the lateral portal. The first thing we want to do is take all the soft tissues off the undersurface of the acromion and outline the meso-acromial fragment. This is the medial aspect, anterior aspect. Again, after taking all the soft tissues off the undersurface of the acromion, again, we start to outline that fragment. Looking from posterior to anterior, radiofrequency device is coming from the lateral portal. This is the medial aspect of that fragment. Again, you're starting to see the outline of that bony fragment, posterior aspect. As we come out more laterally, you'll see the lateral aspect of that bony fragment. Deltoid fibers to the left. Anteriorly, again, stripping all the soft tissues away from that acromial fragment. Working again anterior and then more medial by the AC joint. So by the end, we've outlined that entire meso-acromial fragment. Posterior aspect of the fragment, lateral, anterior aspect, and medial aspect. Once we've defined it, the arthroscopic excision starts to occur, just as if we're doing a acromioplasty. We start with the anterior aspect and then start resecting the entire undersurface of the acromion. Again, the purpose of this is try to preserve those deltoid fibers on the rest of the acromion. So once we start seeing the deltoid fibers, we know we've gone deep enough. Here again, we are shelling out the undersurface of the acromion, the burr coming from laterally as we work our way more medially. Again, a sweeping motion from front to back or anterior to posterior, also coming out laterally. Similar to what we do with an acromioplasty, but this time we're actually going to shell out the entire piece of that acromion. It's very important to get the medial aspect and also the anterior aspect of that. We don't want to leave any shell of bone. Again, out laterally and also medially. The very posterior aspect, as you can see here. Always titrating our suction to make sure we get all those loose bony fragments out of the shoulder joint. We then remove the arthroscopic burr and put the shaver in to check the removal of the entire fragment. Again, looking from posterior to anterior, shaver through the lateral portal. Again, we've excised that entire meso-acromial fragment, but we've retained those deltoid fiber attachments to the rest of the acromion. Postoperatively, you can see the supraspinatus outlet view with resection of that meso-acromial fragment.